a full facelift 4 months ago with a famous, renowned surgeon. Why do I look worse after my facelift? While my upper face looks great, the lower half is worse than before and my face looks distorted. I have a downturned mouth with little fatty masses on either side that resembles Marlon Brando in The Godfather. I still have jowls, hollow cheeks, and I have too much volume in my jawline. I'm going to see him soon and hopefully he'll know what has gone wrong, but I wanted to be armed with some second opinions.
Thank you for your question. You submitted your question with some photos, and you describe in your question that you had a full facelift 4 months ago by a world-renowned surgeon, and you are concerned that you feel that you look worse after undergoing the facelift, and you state in further detail that you are fine with the upper part of your face, but you feel that the lower part of your face seems to look worse. You describe a situation where the corners of the mouth are downturned. You feel that you still have jowls, that you have a certain resemblance because of some fatty pockets to the late Marlon Brando. You are talking about having too much volume in your jaw. Well, you wanted to further go back to your doctor, but you wanted to be, quote, armed with second opinions. Well, I can certainly share with you my perspectives, even though I did not have the benefit of seeing your preoperative photo, but I think I can certainly understand what your concerns are, especially with the knowledge and experience I have as a cosmetic surgeon. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facelift surgery and solutions for facial aging has been the core of my practice throughout my career. And certainly there was a period of my career where I was doing many facelifts a week to help patients like yourself. And this type of challenge certainly is something I'm not unfamiliar with. So let's understand a few things before you go charging at your surgeon. To begin with, there is an important understanding that every patient I try to relate to about facial aging. And certainly as of late, a lot of people who have been coming to me for facelift consultation are looking at me sideways when I tell them that they're really not good candidates for facelifts. I'm not saying that that's the situation with you, but I'll explain why I say what I'm saying. To begin with, it's important to understand that facial aging has two major factors. One is volume loss, and the volume loss is something that we have more understanding of than we've had in the past. And what that means is that proportionally a large percentage of facial aging volume loss that's responsible for much of the concerns that people present with when they come to a doctor like myself has to do with bone loss. And bone loss, bone is the structure, the foundation of our facial anatomy. Beyond that, it's fat, muscle, and soft tissue. And so there's a significant element of facial aging that is from that loss. The second part is loosening or sagging. Now that element has always been a key part of the surgical approach to facial aging. When I was in training back in the 90s, it was essentially if it droops, we as surgeons lift it. Now, of course, not everybody has an isolated issue. There are different elements of each that help contribute to a person's appearance. So I would suspect that if you were to compare your before and after photos, that any element of sagging that was addressed by a facelift was probably satisfactorily achieved. Every surgeon who performs facelifting surgery, world famous or otherwise, who is experienced and knowledgeable will attest to the limitations of lifting based on all the other variables that are present. Some people have more full faces, some people have thinner faces. But one thing that is appropriate is when there is enough sagging or jowling and a lot of laxity or redundant tissue on the neck, well, facelifting is the optimal procedure for repositioning. It doesn't mean it solves everything. A lot of people come to me who have had facelifts done elsewhere, and what I discuss with them is essentially the other critical element to youthful appearance, and that is volume. In our practice, we have used both as a primary and as a secondary procedure, a process called structural volumizing. Structural volumizing means what I do is place long-lasting hyaluronic acid fillers at the level of the bone. As I stated earlier, bone structure is what diminishes the most. Therefore, it makes sense in a situation like yours that once the healing process has settled, that volume correction will probably significantly assist in restoring a lot of the areas that you want to see improved. So I think that in addition to the issue with volume, as far as the downturn of the mouth is concerned, well, you have to look at your before and after photos to look at the curve of the mouth before procedure, but you can do something as straightforward as a Botox outer corner lift, and that's just the placement of Botox at a strategic place to get the outer corners to come up. It's a relaxing of a muscle called the depressor anguli oris. This soon after a facelift is not the time that I would generally recommend that, but I think that you can understand that in the context of what your preoperative appearance was, that most likely your surgeon did accomplish what the surgeon wanted to. But in addition, there is an opportunity to take care of the volume loss. When I said that patients look at me sideways sometimes when they come to me expecting me to do a facelift, and I tell them that they're a better candidate for structural volumizing, essentially it's based on this knowledge and experience that patients who have come to me, it just happened the other day, that someone came to me who had come to me 3 years ago and wanted a facelift, and I told them that they're not quite ready for a facelift. They went elsewhere, got the facelift, and then came back to me saying they were unhappy with the outcome. Why? Because their real issue was about volume. So for this patient, I'm going to be doing structural volumizing. So it's really about the understanding of these principles that help to give people perspective. And when I do a consultation with patients about facelifting, I always point out the areas where there is volume loss. A lot of times people are under the misapprehension that the definitive procedure for all facial aging is a facelift surgery. And if they only do one surgery, that'll take care of everything. And I explained to them that a facelift is good for repositioning, but it doesn't change the need for injectable fillers and other things. Yes, lots of people want to try to get around that through fat grafting, implants, etc., but it's a matter of what that surgeon's personal approach is. But I could tell you as an experienced surgeon that this balancing and synergy has worked out very, very well in my hands and in my practice. So I would say go meet with your doctor to discuss these issues, and I don't think that your surgeon in any way did anything that would have been detrimental, but hopefully you'll be able to work together on a strategy to help the other areas as I discussed. I hope that was helpful. I wish you the best of luck. Thank you for your question.